Thank you, Alan. And we are continuing our coverage of the University District Hospital closure. And tonight we hear from the wife of a patient who previously relied on their services. Takur Conlu joining us now in studio. Now, Tucker, that woman you spoke with's husband was a patient at the hospital's outpatient rehab center.
That's right, Kendall, I did. I spoke to Susan Kilber, whose husband was diagnosed with Parkinson's. They received care from the staff at PeaceHealth's Rehabilitation Center.
At his memorial service, many people attested to this. He was a very intelligent human being, but an extremely kind and gentle person.
David Kilber passed away in 2019, but before then was receiving care from PeaceHealth's University District Hospital, specifically at their outpatient rehabilitation facility. The facility is a service offered by the hospital, helping patients who suffered stroke, multiple sclerosis, dizziness, spinal cord injuries, ALS, and Parkinson's. Susan and David were part of the PeaceHealth network before seeking these services. She says that they took care of him with every aspect of life, even at their home.
Mobility was probably one of the biggest challenges we faced, so he had many falls, really severe falls all over this house. He got PT and OT, physical therapy and occupational therapy. And one of the things that was wonderful about them coming here is they would tell you exactly, they would go through his life, help you. How does he get out of bed? How does he go to the bathroom?
She says the staff and resources were invaluable.
In the clinic, you had all the equipment, of course, but the key thing, one of the key things about the clinic is the staff. And what would happen is if you saw one person, they would also have been talking with somebody else, so that you didn't have to go through the same thing with another person that you had not seen before. That's not something you just set up. You know, you can't just get rid of these people and then think you're going to go somewhere else and get that. It doesn't work this way.
With the loss of an important service like the outpatient rehab facility, there is concern for coverage in the community.
There's some people that are doing individual therapies at other clinics.
But again, it's not the same.
But it's not the same as having a team, and it's not the same. They don't have that equipment that they have there.
Now, 4 years since David passed, Susan would not have been able to receive the same care that she did then today. Driving somewhere for these facilities is not an option either, especially in a city the size of Eugene. The fate of the clinic is not currently known. In our last coverage of the facility, we were given a statement from PeaceHealth that said, PeaceHealth values both its inpatient and outpatient rehabilitation programs and is exploring options to maintain and relocate those services after the closure of the University District Hospital.